We just came back from Baltimore doing our third annual opioid summit. So we're doing our best to go out and try to figure out how, with whatever money we've got, we can build out some basic treatment and basic education and get the universities and colleges involved everywhere so we can keep everybody alive. And that's the most important thing. You got a chance as long as you're breathing. Here's the deal. Number one, you would like to stop people from dying. You need a network that gets Narcan in as many hands as possible.
Come on in here, step right up here, and I'll show you how it works. We have a huge uptick in the number of opiates going out. It could be patient-specific, it could be disease-specific, or we could have a problem. And that's the beauty of this integrated system. We know all the way from manufacturer to bedside. We have escalated the amount of prescribing over time, and that was going back a decade. This wasn't something that started yesterday.
Time, yeah.
So now it has reached a tipping point.
The Azalea Project is an initiative in the prevention of substance abuse in pregnant women to prevent babies from being born substance exposed.
I didn't know much about changing diapers or anything for me, so the parenting classes, just the day-to-day care for my son, I learned a lot. My son is now 3. He's healthy, and April of this year, I celebrated 4 years clean and sober. And so, yes.
Well, I just saw some people who are committed to raising their kids well and to helping other people stay off drugs while they're pregnant and get their children off to a good start in life.
Further my education, they help me with that as well. So it's not just about the kids, it's about me moving forward for my kids, for us to have a better life.
But it emphasizes the responsibility we all have to make sure wherever there's a drug problem, which is just about everywhere in America now, that people know as early as possible how much damage it can do to any newborn child.
In America, 1 in 6 adults don't have adequate access to healthy food. About 40% of food in the United States is wasted. And what our students do is they recover food that would normally be thrown away, and they repackage it into healthy meals that are shared with people in need in our communities.
Just think what a difference it would make if every university in the country did this.
We're hoping to expand. We're looking at hospitals as another avenue of wasted food that we could help many people.
What I saw was a lot of really committed people trying to figure out how together they can stop anybody from falling through the cracks. If you watch the change in food production, and I'm watching all these production patterns change as the climate change, and even we in America are not going to be able to afford to waste food. And all over the world, the most efficient nations of food recovery are going to have much healthier societies and much more stable economies. And it's going to become a global problem. And never forget that you were here on this day watching this when you see this become a global trend. There are so many good things going on here. About all we try to do is get everybody to work together and figure out how everyone can make a contribution to reaching a common goal.